Here's the right clavicle. There are 4 structures you're going to need to know for this. The sternal extremity and the acromial extremity. These are the 2 ends. So here's sternal and here's acromial. It's kind of hard to tell them apart, but if you remember that sternal extremity is more circular and then acromial extremity is flat, you'll be able to tell them apart. So sternal is circular, sternal extremity. Acromial extremity is a little flatter. And then you have deltoid tuberosity and conoid tubercle. Conoid tubercle is going to be that little bump on the acromial extremity side, that little bump. And then on the top side, we're going to have deltoid tuberosity right here, that rough patch. Now we have the scapula. There's going to also be about 20 or so that you're going to need to know on here. We're going to start with the superior angle, the superior border, and the scapular notch. On the other side, looks like this. Superior angle, superior border, and then scapular notch right here. Right next to scapular notch is this process right here. This is the coracoid process. On this side, coracoid process. This is scapular notch that we just saw. It's easy to get these 2 processes mixed up. The acromion, which is this one right here, and the coracoid over here. The acromion is attached to the spine of the scapula right here, while the coracoid is right next to scapular notch. So then with that said, here's the spine and the acromion. On the acromion, there's a little facet on the edge. That's where the clavicle, the acromial extremity of the clavicle attaches. Now there's going to be a couple of fosses on this bone. First, we're going to find the infraspinous and supraspinous. So infraspinous is going to be right here, underneath the spine. Infra means below, and spinous refers to the spine. So infraspinous fossa. Above, we have the supraspinous fossa, which is this entire divot right here. So that is all going to be supraspinous fossa because it's above the spine. Then we're going to move over to this one. This is the glenoid fossa. This divot is where the head of the humerus attaches to. Then on this divot, there are going to be 2 bumps that you're going to need to know. First, it's the supraglenoid tubercle and the infraglenoid tubercle. This is above the glenoid fossa and below the glenoid fossa. So supraglenoid tubercle, infraglenoid tubercle. Then on the other side, we're going to find the subscapular fossa. And then to finish off, we have just a couple of borders. So this is going to be your lateral border, your inferior angle, medial border, and then there is going to be the lateral angle. Right about, let's see, lateral angle is on this bone right underneath coracoid process. Okay, here we have humerus, and this is a right humerus. And there are going to be about, I think, 20 or so structures on here that you're going to need to know. First, we have head, which is this ball right here. This is what attaches to the glenoid fossa of the scapula. So head, and then 2 tubercles. There's greater and then lesser. Sometimes you can get a little confused, and it's not easy to tell which one is simply bigger. I like to think of greater as wider. So this is wider tubercle than lesser, that's over here. Then we have the intertubercular groove, which is the groove in between the 2 tubercles, the lesser and the greater tubercle. Then there is the surgical neck. I think I forgot to mention the actual neck, which is around the head right here. So the circumference around the actual head. Then there's a surgical neck. This is where they cut the shoulder to do a shoulder replacement. The deltoid tuberosity is going to be sort of on the anterior side. You'll find a rough patch right about there. Then the nutrient foramen, not really shown on most models. There's a bit of a hole right there, but that's going to be a little hole for blood vessels. Then we have the lateral supracondylar ridge. The lateral side is the opposite from the head. So lateral is going to be this side, medial is going to be this side. So lateral supracondylar ridge, this is that sharp ridge that leads into lateral epicondyle, that little bump on top of the lateral condyle. Then we have medial condyle, medial epicondyle, and then medial supracondylar ridge. Then there's going to be 3 fossas that you need to know. There is the coronoid fossa, the radial fossa, and then the olecranon fossa. Olecranon fossa, it's the only fossa on the posterior side of this bone, but then sometimes you can get confused with coronoid fossa and radial fossa. The way that you tell these apart is that the radial fossa, which is a divot for the radius is on the lateral side of an arm. So then you can think of this as this is the lateral side of the humerus. So the radius is going to be on this side of this imaginary body. So this would be radial fossa, and coronoid fossa is medial because that's where the ulna is. Okay, so here we have a left ulna, and on the ulna there are going to be 4 significant structures on the sort of knobby end of it. There's going to be 2 processes and 2 notches. First process is olecranon process. That is this first end of the ulna right here where my fingers are. This is olecranon process. Then below it is going to be coronoid process. These are the 2 that articulate with the humerus to allow the movement of the elbow joint. And in between the 2 processes, it makes this kind of half moon shape. So then that's why this is called the semilunar notch, right in between there, semilunar notch. So those are the 2 processes, olecranon process, coronoid process, semilunar notch, and then a radial notch right here. It's a little weird to say that there is a radial notch on the ulna, but that's because the radius attaches to this notch. So we have 2 notches, 2 processes. So semilunar notch, radial notch, right here, semilunar, radial, and then olecranon process, and then coronoid process. Then peering off of the radial notch is this sharp edge, which is supinator crest, right here. Then there is a tuberosity underneath the coronoid process. There's a rough patch. So kind of on the opposite side of radial notch, there is a ulnar tuberosity. And then all the way on the bottom or other end of the ulnar, you're gonna have a head, a neck, and then a styloid process. And then along the body, there's going to be this sharp edge. I'm not sure how visible it is on camera, but there's going to be this sharp edge, which is an interosseous border. Osseous or ossified, I'm sure you have heard words like this before. That refers to bone, and then inter means between. So this interosseous border, between bones border, is going to be in between the ulna and the radius. Okay, here is a radius. This is a left radius. And we're going to start here. Here is the head, and then around the head, that circular part around the head, is the articular circumference. You're going to find a little bump with a rough spot right underneath that. That is going to be radial tuberosity. On your booklet, it says that there's a nutrient foramen. So somewhere along the body, there's going to be a little hole for blood vessels. They're usually not well depicted on bone clones. Maybe it might be that, but that's where blood vessels run through. This will probably not be tagged on the quiz. And then on the other side, so that was the head side, this is the other side of radius. You're gonna find the ulnar notch, which just like on the ulna, we found the radial notch. This is where the ulna attaches to the radius. So not on the styloid process side, but on the other side, that's where ulnar notch is. Ulnar notch. It's having a hard time picking up this divot, but that right there is where the ulna attaches. Then we're gonna find a styloid process, and then a body and interosseous border, an in-between bones border right along here. It's also important to note that on the ulna, the styloid process was on the head. On the radius, the styloid process is on the opposite side of the head. So this end of the radius with the styloid process is not the head. The end with the articular circumference is the head. This is the head region. This is the styloid process, but is not the head. On the ulna, it has the styloid process on this end, and this is the head. So don't get those two things confused. Okay, this is a hand, the bones of the hand. And what we're gonna find is first the carpals. We're gonna find scaphoid, lunate, triquetrum, and then pisiform. It kind of looks like on some bones that pisiform and triquetrum are the same bone because it might be fused because the model is not made that well. But on here, they are two separate bones. So make sure you realize that it might look like one bone on some models, but this is definitely two. So scaphoid, lunate, and then triquetrum, and then pisiform sitting on top of that. And then trapezium, trapezoid, capitate, and then hamate. Hamate has this hook right here. So once again, that's scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Then we have the metacarpals and then the phalanges. Now to recognize one of the metacarpals or phalanges, you first need to use the singular. So that's going to be metacarpal or phalanx for one of the phalanges. And then you need to number it from 1 on the thumb side to 5 on the pinky. So for example, this would be the first metacarpal. To recognize the phalanges, you need to do the finger, so 1 through 5, and then the position that it's in based on its distance from the body. So for example, this one would be with the red tape, it is the second, because it's a second finger, proximal phalanx, and then on and on. So this one would be the second middle phalanx and then second distal phalanx. Okay, now for right and left of all the bones, for scapula, make sure you have the concave in part of the scapula facing away from you. Then the glenoid fossa is going to point you to whichever side it is. So this is a left scapula. For humerus, make sure that you have the head pointing towards your body because the head is medial, and then make sure you have olecranon fossa pointing to the posterior side of your body. So then this one is going to be a right humerus because it'll attach to your body. If your body is about right here, it'll attach, and you're facing towards the door, then the humerus is going to attach to the medial side, and then the olecranon fossa is going to be pointing backwards. So then this is going to be a right humerus. Clavicle is the hardest one. You need to remember 3 things: sternal extremity, the conoid tubercle, and then the way that it curves out at the acromial extremity. So then first find the sternal extremity, which is the circular side. This is flatter, that's the acromial extremity. Circular is sternal extremity. That's gonna go on your sternum. So no matter what happens to the bone, that is gonna be on your sternum. Then you need to find conoid tubercle. It's the only tubercle on the bone, at least in the case of this class that we're gonna study. That is gonna point down. Then the acromial extremity needs to curve outward. So if this clavicle was on an imaginary person that was facing towards the door, this clavicle would be a right clavicle. If it were the other way, on an imaginary person facing the door, then the acromial extremity would be facing towards the person. It needs to be facing away from the person. So then sternal extremity on the sternum, conoid tubercle pointing down, and then acromial extremity facing out. The hand, you find the thumb and then match it to your own hand. The thumb is the only one with 2 phalanges, and then you can kind of match the curvature of the hand model to one of your own hands. For the ulna, I like to find the olecranon process, the coronoid process, kind of grip it in either hand, and then you're going to want to find the radial notch and put your thumb on the radial notch. Now, point your thumb at yourself and then look at the styloid process of the ulna. Whichever side that the styloid process is on, that's the side it is. So since the styloid process is on the left side, this is going to be a left ulna. And then radius is the easiest, kind of a similar thumb trick. You're going to want to find the styloid process of the radius. Put your thumb on the kind of concave inside of the radius. There's another part where it's sort of bumpy and there's no natural position to put your thumb on, but there will be a nice spot where you can put your thumb on, and then the stylus process will point you towards the side. So this is a left radius as well.